Lord, thank you for this day, for the presence of everyone in this call. For once again, we are gathered and given the opportunity to appreciate life and your words. Forgive us for our shortcomings and cleanse our hearts as we learn and live your words and example. Father, bless our endeavors, especially today's meeting. May you guide us in our discussions, and may you enlighten our minds in every decision that we make. Give us your grace that we may effectively do our parts for your greater glory. All this we ask in Jesus' name. Amen.
PCP and PISMID, and a member of the DOH Interim National Immunization Technical Advisory Group. Before I begin, I would like to acknowledge the following. Dr. Maria Encarnita Limpin, the President of PCP, Dr. Danilo F. Baldemor, the Champion Regent, Committee on Media Communications and Health Forum, Dr. Gingerlita A. Samonte, the Chair, Committee on Media Communications and Health Forum of the PCP. Good morning to all the virtual participants and welcome. The PCP Health Forum is conducted twice a month by the PCP Media Communication Committee for the media and the public and streamed via Facebook Live, YouTube, and Zoom. PCP partners with subspecialty and affiliate societies and features topics on health and gives lay information about prevention and treatment of common diseases and other conditions. For today's Health Forum, PCP collaborates with PSMID for this talk on COVID-19 variants, vaccines, and other updates. This activity is a COVID-19 information and COVID-19 vaccines communication campaign to empower the participants with evidence-based information to advocate for vaccination. For today's Health Forum, we changed the format a bit. I will be asking our speaker a few questions before and during his presentation, and all your queries about today's discussion will be answered once the speaker has finished. This morning, we are graced by Dr. Ronchin Salante, the current Secretary of PCP and a member of the DOST Vaccine Expert Panel. Good morning, Dr. Jean.
Good morning, Net. Good morning to everyone.
Okay. Let us start with the discussion. The country has been vaccinating its individuals since March 2021, yet we are seeing an increase in the number of cases. Are we seeing any changes in vaccine efficacies, or what will be the different vaccine efficacies that we are seeing right now?
Okay. First of all, I would like to show the current numbers now. Numbers that are very important on how we move forward and approach this pandemic. Okay. So let's take a look at the global numbers. No? So ito yung collated data from the WHO. And see most of these regions from America, Southeast Asia, Europe, and even some of these countries are really having surge of cases, increase in the number of cases. So this is the weekly cases and death report based on this WHO report. And you'll notice, you can focus here in the Philippines. This is the dark, violet color. And there are specific countries that are driving the increase in the number of cases here in Southeast Asia. And I would like to single out Indonesia, which is currently also experiencing more than what the Philippines is experiencing now in terms of the daily number of cases and also the mortalities. And nakikita natin dito na there are 34 countries reporting more than 50% increase in new death and increase in new cases. Okay, so this only tells us na patuloy pa rin na tumataas ang mga kaso despite the massive vaccination rollout. At alam natin na ang mga different countries na to, iba-ibang porsyento ang nabakunahan sa kanila. And that's why some of these or most of these surges are driven by those that are not or has not been vaccinated yet. Next slide. Okay, so dito naman sa atin, this is the Philippines. Okay, so this is the report August 15 coming from the Department of Health COVID-19 tracker. So there are 5 regions that we could see there. The current cases are coming from. You have NCR, 34,121 new cases, 146 deaths. You have Central Luzon, which is also a very high number of cases, but higher number of deaths compared to NCR. And then you have Calabar Zone. In Central Visayas also, you have higher number of deaths, and also that of Western Visayas. So I would just like to point out here that the reproduction number has really increased for the past 2 weeks now. In fact, in this report, which was yet last week or last 2 days of July, it has been above the reproduction number of 1. Okay? And we know that the higher reproduction number is also a reflection of how many people are infected. And exponentially, this may be a reflection of why we have more cases now compared to 2 weeks ago. And this is the total current number of deaths that has been accumulated since the start of the pandemic, and almost 1,700,000 plus cases of COVID-19. Next slide. Okay, so one of the important aspect when we look at pandemics and surge of cases, palagi natin itong ini-emphasize, no? Are we capable of managing this patient on the part of the healthcare facilities? Kasi dito talaga tumataas ang healthcare utilization. And when you look at patients with COVID, when they will be admitted, most of the time, these are the more severe and critical patients. No? So dito, importante ang supply ng mechanical ventilator na minomonitor ng Department of Health, including the isolation beds, especially for those who are critical, ICU beds. And I think medyo mataas talaga ang utilization. No? This was still August 14, no? More than 61%. So these are some of the metrics na kailangan babantayan natin while we are on ECQ, because this healthcare utilization will be really overwhelmed. Ibig sabihin, more than 90% ang utilization nito. Talagang we need to do something in order to expand more and accommodate patients that are supposed to be admitted. Next slide. Okay. So the question of Dr. Rosario is, yes, we have surge of cases. Our health utilization is really challenged. And the question then is, do we feel the effect of vaccination at this point? No? Kung titingnan natin, ang porsyento ng nabakunahan sa buong Pilipinas is not more than 15%. No? And the target is really to vaccinate as many as possible as we can. And if we cannot reach a particular percentage na tataas ang vaccination rate natin, I would say that we will continue to have all of this surge of cases, increase in the cases. But what is very good here is that when you look at our vaccines, no, these are the list, no, of vaccines in the Philippines that were given EUA approval. Okay? And palagi nating sinasabi yan na ang bakuna ay isang bagay na maprotektahan ang tao para lang hindi makuha mo yung or ma-develop mo yung more severe cases, no? And here in this particular slide, it showed here that since most of the vaccines, no, I would say most of the vaccines can prevent severe disease, then high likelihood that they can also prevent death, no? And hindi ko na kailangan isa-isahin to, pero nakikita natin na mataas talaga ang protection for someone who got to be vaccinated and maiwasan na mamamatay. Next slide. Okay, so this is the slide that I told you that mataas ang benefit ng bakuna because of this ability to really protect us from getting severe. And in our current prioritization of vaccine rollout, aside from the healthcare workers, we knew that those 60 years old and above and those with comorbidities, usually the mortality rate is very high, and I think it was like 80%. And with vaccination, this will really be an important benefit when you get to be vaccinated, because you'll be preventing this part of the infection that will make you stay in the hospital longer and sometimes makes you have a higher mortality. Next slide. Thank you. Thank you,
Dr. Jean, yung concern about the Delta variant, ano po ba dapat ang pinoproblema natin tungkol sa variant na to, at ano po yung mangyayari dun sa sinasabing nating vaccine efficacy against the variant?
Okay, so siguro I'll have to show some slides here para lang maintindihan natin. Okay, so next slide. So as of now, as of the latest report from the Philippine Genome Center Biosurveillance Report, dito natin makikita the total sample sequence, okay? And these are the corresponding variants of concern. You have the alpha, which is the B117, para lang masundan natin, beta, which is the B1351, and then yung delta, the B1617, and then you have the gamma and the P3 variant. So these three are considered the variants of concern. We'll explain to you later bakit sila naituturing na variants of concern. Pero focusing on the samples, the samples that were sequenced, I would like you to focus here on the last two rows. You have here August 11 and August 12. So for the past several weeks, ang pinaka-common na sequence is the beta variant, and then this is followed by the alpha variant. And these are the corresponding death related with these variants of concern. So pinakamataas ng death is related with the alpha variant, and then you have here the beta variant next, and then obviously the delta variant. But if you look at the last two sequenced, August 11 and August 12, in August 11, a total of 372 samples were sequenced. Out of these 372 samples, 102 of these are alpha, and then this is followed by 59 with beta. But you look at the delta here, it's like 177. And this means that it occupied more or less ang proportion nitong delta over the total number of sequenced na samples, like 48 to 49%. And then dito sa August 12 naman, 373 total sequence, 41 ng alpha, and then you have 66 beta. At dito, mas mataas na ang delta, this latest report, which is more or less, again, 48 to 49% of the total number of sequenced samples. So ano ba ang kahulugan nito? Can we say na ito na yung dominant variant ngayon na nakikita natin sa mga pasyente natin na nagkakasakit at na hospital? Pwedeng sabihin din natin gano'n. Although this only represent a very few numbers of samples, Now we cannot totally say na makaka-conclude na the Delta variant is driving this transmission, but more or less, should we say na ito na ang pinakamataas na so far na sequence in the last sample that were sequenced. Okay. Next slide. Okay, so we made a tabulation. So this is coming from this WHO epidemiological data update. Okay, so there are four very important impacts of these variants of concern. One, its ability to be highly transmissible. At nakikita natin dito na all of these are capable of highly transmissible compared to the original strain. Pero there are two variants here na mas mataas ang hawaan, okay, including that of a secondary attack. So meaning yung mga nahawaan niya, and that has been consistent with Delta and Alpha. Now, pag mataas ang hawaan, do we also see that most patients will have the infection, will have the disease, and will develop the infection? Are they also prone to develop the severe form of COVID Okay? So far, ang nakikita natin dito na there is a very good higher risk of severity and mortality, no, based on more data that were collated. It's the alpha, okay? But if you look at also emerging data with Delta, there are small data coming from Scotland, Singapore, and that most of those that were admitted in their hospital with Delta are mostly ICU admitted and have also presented with a severe type of pneumonia. Okay, so there is also a correlation of more severe form of disease with Delta, no? But we need to wait for more data to come compared to that of the Alpha. The risk of reinfection will always be possible with any of these variants of concern. Okay, why? Because when you have an original infection with the previous strain, because of a mutated strain, then your antibody will not be able to defend you at that point in time that you produce that antibody with the original strain, because these new variants of concern can make reinfection higher compared to the original strain. So that's why, because of that reduced neutralizing antibody na nakikita nila, mas mataas din na pwede kang magka-reinfection. And there was a data in the Public Health England na ang Delta ay mas mataas ang hawaan, second reinfection by almost 2 compared to the twice compared to the Alpha variant. Okay. With regards to the impact on diagnostics, most of this doesn't have any much impact on diagnosis. Sometimes we heard na pag ang variant ba, hindi ba na-detect sa regular RT-PCR testing, no? So all of this can be detected in the RT-PCR. They will just be read as positive. But for us to know if this is what type of a variant, then you need another test, which is the genomic analysis. Next slide. So what we have known about Delta variant, no? So aside from being highly transmissible, okay, so there are already data like in Canada and Scotland that they can cause more severe illness, and the severity is really very high, especially for those mga individual na wala pang bakuna. Okay, and ito yung concern ngayon sa mga unvaccinated people, that when they get the Delta, they are really, not only they can transmit it more compared to a vaccinated individual, but can also develop the more severe form and mostly hospitalized. Although ang fully vaccinated is not also an exemption that they cannot get the Delta, but based on current evidence, okay, kung magka-Delta variant infection man yung fully vaccinated, they can be still infectious, but only for a shorter period of time compared to the unvaccinated. So this is an opportunity for us, no, that if you are fully vaccinated compared to an unvaccinated, you have more harm when you get the Delta variant compared to those with the vaccine. Okay, so that's why vaccination or being vaccinated is very important. Next slide. Okay, so sa question kanina ni Dr. Raminette, no, what is now the concern in terms of how does all of these vaccines that we've been using now perform against these variants of concern? Are these vaccines still effective? They still retain the efficacy, the protection that we want them to have when we get this vaccine? So at this point, we unahin natin, no? Isa-isahin natin. Like here, this is the Alpha variant, and these are some icons that will tell us na most of these vaccines with the Alpha variant, no, talagang there is less than 10% reduction in the vaccine effectiveness or efficacy, okay? Or reduction also in neutralization, no, based on some of this neutralization data. And from the developments of severe disease to symptomatic disease to infection, nakikita natin dito na yung efficacy na nakita doon sa mga clinical trial, medyo nabawasan with any of these vaccines. There are vaccines na walang data, no, na about the Alpha, but again, the WHO, based on their summary of the vaccine effectiveness and efficacy, despite this decrease in what we call this reduction in neutralization and reduction in efficacy, the protection retained against all outcomes. No? So meron pa rin protection, especially the prevention of severe disease, symptomatic disease, and infection. So which means that vaccines are still good against the alpha variant. Next slide. Now the second slide will also give us the different performance of the vaccine against the beta variant. No? So dito makikita natin na based on laboratory tests, no, talagang almost all of this vaccine, bumababa talaga ang neutralizing antibody, no, sa mga bakuna na to. No? But if you look at the vaccine effectiveness and efficacy, medyo hindi masyadong naapektuhan despite a decrease in the neutralization or significant decrease in the neutralization of the antibody. And this has something to do that we need to know that vaccines does not only been evaluated by its efficacy based on neutralizing antibody, but also for some other pathways like the cell-mediated immunity. Kaya medyo maganda pa rin, no? And that's why the summary of the vaccine effectiveness here is that protection is retained, especially against severe, although there are protection by which against symptomatic disease has been reduced. But again, there's limited evidence, and in fact, ang masasabi pa rin natin, all these vaccines are still effective against the beta variant. Next slide. Okay. And then yung gamma, no? So ito yung pinaka medyo konting data in terms of effectiveness and neutralization. Pero dito, with the mRNA, including the Astra and the virus vector vaccines like Janssen, more or less, no, apektado rin sa ang neutralizing antibody when they tested it with the gamma. Pero dito sa effectiveness against severe disease, symptomatic disease, and infection, medyo very unclear yung impact kasi wala tayong mga data dito, and very limited ang evidence. Next slide. Okay, so ito yung pinakahihintay natin, no? Yung Delta variant. No? So palaging tinatanong sa atin yan, ang mga bakuna pa ba natin ngayon ay epektibo pa ba dahil because of this Delta variant? No? Yes, just like any of those three variants of concern, yung neutralizing antibody are affected also by this Delta variant, particularly with the mRNA, including that of Astra and Janssen, and some inactivated vaccines in the form of Sinovac and Covaxin. No? But the data will tell us that even bumababa itong mga neutralizing antibody, there's still protection, especially in the prevention of severe disease, symptomatic disease, and infection. Medyo bahagya lang bumababa siya, pero meron pa rin tayong mga protection against any of this, against this Delta variant. No? So that's why protection, again, especially retained, no, against the severe disease, although there is a possibility that we can get the infection, but at least pag nakuha mo yung infection, you will not develop the more severe disease with the Delta variant. Okay. Next slide. Okay. So I think that's all in a minute for the variants of concern and vaccine efficacy.
Okay. Pero Dr. Jean, we're hearing, or there was a recent report regarding the Lambda variant. So ito ba parang mas dapat ba tayong mag-worry because of this variant?
Okay, so pakita lang natin, no, dito yung illustration, ano ba tong Lambda variant. Okay, so this is coming from this article on a group of Japanese scientists where they were able to really study the Lambda variant, no? And this is considered a new variant of interest and not yet a variant of concern. So kung makikita natin dito, no, to assess the mutations ng pagbabago, no, itong Lambda variant ito, may mga mutations doon na pagbabago dito sa spike protein. Okay, and just to summarize this one, no, ano itong mga mutations dito sa spike protein that will make this potential, why is it a variant of interest? One, meron siyang mutation that can make this virus highly infectious, no? So ito yung area of mutation. Tapos meron din siyang possibility that it can also be resistant to antiviral immunity, including that of vaccine. Okay? Next slide. So just to give you some additional information, so this variant of interest was designated by the WHO last June 14, 2021, when there was spread of this variant in South American countries, particularly in these three countries, Peru, Chile, and Argentina. Okay, and in June 29, 2021, this variant of concern or variant of interest was already isolated in 26 countries, no, as reported by the Global Initiative on Sharing All Influenza Data, or the GSED. Now, in spring 2021, okay, Chile is one of those countries na mataas din ang vaccination rollout. Okay, they experienced a big surge of this infection, suggesting that Lambda variant is proficient, okay, in escaping from antiviral immunity elicited by vaccines. No? So that's, I think, one of the concern nila na proof nila na based on their experience na Lambda variant ang marami sa kanila na despite na nabakunahan, medyo nagka-develop pa rin ng COVID infection. Okay? Next slide. So how is this variant compared to the other variants of concern? So dito sa data na pinalabas nila, no, yung effectiveness of Delta, including Epsilon and Lambda variants, were significantly higher than that of the original strain, which is the D614G. No? So dito makikita natin, no, yung infectivity percentage. Dito yung Lambda, dito yung Delta. Okay? Delta yung pinakamataas, then this is the Alpha, the Beta. So there is really a possibility that this variant of interest can be highly infectious, just like what we have experienced with Delta and the other variants of concern. And when they also tested the neutralization, okay, among those in these mutations, there was also some form of decrease pag kumukonte, no, ang neutralization titer, the 50% neutralization titer. So that's why they concluded that aside from possibility of causing more infection because of higher infectivity, then there's also potential decrease that it can also affect some of these vaccines. But we need to wait for more data on that. Next slide. Okay, I think that's my slide, last slide, Net.
Okay, but for all the information that we received, the message that we want to put out here is that vaccines actually work, no? Nakikita nyo dito, parang sobrang simplified version talaga siya ng pag-compare kung ano yung nakukuha nating proteksyon kapag nagpapabakuna tayo or hindi tayo nagpapabakuna. So, tulad ng sinabi ni Dr. Solante, ang proteksyon po ay second dose kailangan dun sa 2-dose vaccine or dun sa 1-dose vaccine, dapat nakalagpas tayo ng 2 weeks or more para makuha natin yung benefit or yung benepisyo mula dito sa mga bakunang available sa ating bansa na under EUA, tapos safe and effective po sila. Dr. Jean, any other updates regarding vaccination?
Okay, siguro I'll have to show to them, no, yung report ng FDA, no, just to give them more confidence, especially sa yung mga nag-alala about adverse reaction. No? So dito, nakikita natin, no, as of August 8, 2021, no, ito yung mga indicator na reported numbers of individual partly vaccinated. You have 13 million, and then you have here fully vaccinated around 11 million. And the total number of doses administered already is around 24 million plus, no? But if you look at the number of suspected adverse reaction report, it's like 55,000 out of this 24 million, okay? So that's only around 0.23% of the doses administered, no? So napakababa ng mga what we call adverse reaction, okay? And there is also what we call suspected serious adverse reaction report. No? Out of this is like 1,569. So kadalasan dito yung mga severe allergic reactions, no, that necessitated patients to be admitted. No? Kasi ito yung isa sa criteria for an adverse reaction na nadala sa hospital and has been treated. No? So again, overall, makikita natin, these are only very few. It's like 0.006% of those administered. No? So panatiliin natin na talagang yung benefit, no, always outweigh the risk. And if you're thinking of, iniisip mo na natatakot ka sa bakuna, no, so ito na yung mga data natin na makikita na talagang napaka-safe ng bakuna na currently na ginagamit natin, dahil ang FDA, ang Department of Health ay talagang minomonitor itong mga adverse reaction para lang maibibigay natin sa publiko na at least makikita nila na yung mga adverse reaction are very tolerable at safe, at yung benefit is really important with vaccination. Next slide. Okay, so dito naman, no, another AFI report, no, so they look at specific vaccines, okay, at saka after giving the vaccines, na nakikita natin kung how much of those or how many of those still develop the infection. So dito tayo mag-focus, no, number of people who got COVID more than 14 days after the second dose, and ito yung corresponding death, no. So I think most of you have seen this data na Sinovac here, 91 out of the 5 million vaccinated, okay, 91 only got the infection, and only one died. And then AstraZeneca, 3 million got the partly vaccinated. Fully vaccinated is 908,000. Only 24 developed the infection. And the rest, like Sputnik, Pfizer, Moderna, and Janssen, very negligible na yung mga numbers nila, no? So in fact, nakikita dito na this is why we need to get the vaccine, because yung protection is very high, and especially protection from severe illness and death. Next slide. Okay, so yung mga iba na nag-iisip na magpabakuna, no, meron tayong other vaccines aside from COVID-19, kagaya ng pneumococcal, no, and influenza, no? So dito, ito yung statement ng Philippine Society for Microbiology and Infectious Diseases on the timing of administration, no? So dito sinasabi natin na yung decision, no, to co-administer like a pneumococcal or flu vaccine with COVID-19 should be a shared decision making, no? So kailangang pag-usapan ng pasyente at yung doktor na nagbibigay ng bakuna, okay? And ano ba yung mga points to consider, no? I-discuss, no? Ito yon, yung kung halimbawa itong babakunahan mo ng pneumococcal or flu, mataas ang risk niya na makakuha siya ng pneumococcal or flu infection. So aside from COVID-19, you have to offer that, no? And you don't delay the administration of a flu or a pneumococcal, because it's also as important as that of COVID-19, no? So you have to consider not delaying receiving the recommended vaccine, okay? And if it is also co-administered, the healthcare person should also advise possibility of increased likelihood of common adverse event, no? Like for example, if you're giving COVID-19 and ang pinaka-common na adverse event is pain at injection site, that's also one of the most common adverse event reaction na makikita with influenza, flu vaccine, or even pneumococcal vaccine. So it's really important to explain that. And sometimes if you give both magkasabay-sabay yan, baka ma-misinterpret ng pasyente, no? So sometimes you need to balance kung kailangan mo siyang bigyan ng sabay, or you can have interval either 5 days or 7 days, no? Pero next slide, makikita natin yan dito sa next slide kung when can we get the flu and or pneumococcal vaccine, no? So ito yung interval ng mga bakuna na binibigay natin sa COVID-19, no? Okay? So for example, Sinovac, Moderna, Pfizer, or Sputnik, okay, you may get your flu or pneumococcal vaccine anytime or a week after receiving the first dose while waiting for the second dose as recommended by your doctor, or you may opt to wait after completing your second dose as recommended by the doctor, okay? With regards to receiving the second dose of this vaccine na nabigay na, no? You need to get your flu or pneumococcal vaccine anytime or week after as recommended by your doctor. So same as that also with AstraZeneca and Janssen, you need to get your flu or pneumococcal vaccine anytime or a week after your first dose of any of this vaccine while waiting for the second dose. Okay? How about those na hindi pa na-receive yung any dose, no? So while waiting for the availability of a COVID-19 vaccine, Siguro habang hindi pa available, hindi pa kayo tinatawag sa LGU, then probably you can be offered the flu or pneumococcal habang hinihintay mo yung COVID-19 vaccine. Okay. Next slide. Okay. So, Net, sa'yo na to, Net.
But this is just a reminder that we have the vaccines available to us dito sa ating bansa. Kapag po ang mas importante po is magrehistro kayo. Kasi kahit nandyan yung bakuna, kung hindi kayo nagrehistro or your loved ones hindi nyo pinarehistro para matawag sila sa LGU vaccination site, hindi mangyayari yung pagbabakuna na yon. But let's go for vaccination. That is our united message for both PCP and PSMID po. Next slide. So the vaccine protects you and those around you. Thank you po for listening into this discussion. Now I'll open the floor for questions. Dr. Jean, I'll start out with the most frequent. Pag tinali ko kasi most frequent question to eh. It's one of the first questions. There was the data on Sinovac vaccine efficacy was not presented in the table regarding prevention of hospitalization or severe disease. Can you comment on that po?
Actually, hindi ba natin nailagay yan? Anyway, the Sinovac, no, based on the phase 3 interim data, we know that they have a higher protection, especially against severe disease, hospitalization, and ICU. Okay. Probably banggitin ko yung experience sa Chile, wherein the real-world effectiveness data of Sinovac was evaluated based on 10 million doses administered in that particular country. And it has protected against hospitalization in 86.3%, and then death in I think it's 87%, and then ICU admission around 93%. So mataas ang protection in the real world data na kung saan binigay itong Sinovac doon sa Chile. And I think this is a country, Chile is also a country where you have also some of the Lambda or even the Delta variant.
Okay. Thank you po, Dr. Jean. Another question is about immunity. This is from Gregorio of TV5. With the public's concern about the impact of variants decreasing vaccine efficacy, may we seek further explanation on the two immune pathways and why we should not worry about the impact of the variants?
Okay, so ang nakikita natin palagi na mini-measure, especially sa mga studies, is the neutralizing antibody titer, no? But doon sa mga clinical trials, they also measure the cell-mediated immunity, no? Yung T-cell response, no? The interferon, which is also equally important as that with your antibody, because your antibody protects us from getting the infection. But your T-cell is the one that will really kill the virus once it goes inside the body, no? Yung ano niyan, importante. The second part here is your T-cell, the memory cells. These are cells that are capable of recalling the antibodies once it recognized na merong infection ng COVID-19. And this is the one that is responsible for the durability of protection, the T-cell memory. Most of the studies sa mga ginagawa ngayon na mga vaccines, ang pinapakita is the neutralizing antibody titer. But there are also who are showing the cell-mediated immunity parameters or results of this vaccine. Kaya ang palagi nating sinasabi, we cannot just rely on the neutralizing antibody, although ito yung mga ginagamit as a parameter na magsasabi na bumababa ang protection. But again, we don't have an immune correlate at what level of the antibody na wala tayong protection. So hindi natin siya magagamit talaga as a sole parameter na magsasabi natin na bumaba ang protection natin.
Yes, and there are studies actually trying to look into the other correlates of protection na binanggit nyo. Tama, Dr. Jean. And
Yes.
then I'll try to answer this comment. There are plans of what will be the plans of the government against the Lambda variant, and will it cause another ECQ? My take on this you may add, Dr. Jean, my take on this is more about, we're talking about behavior. The transmission is the same. The behavior of the individuals will actually matter. So if the ECQ will be based on what is happening in the community. Now, if we don't adhere to the public health standards that are being advocated and recommended, I think the issue of another ECQ with the Lambda variant will still be there.
Yeah,
Okay.
so siguro explain natin Minette, no, yung importante yung health protocol, no, following the health protocol, especially with the emergence of this highly transmissible variant. Okay? And hindi naman pwede na every time tumataas ang kaso natin, mag-ECQ tayo. We should learn to be disciplined enough, no, on how to protect ourselves, how to behave correctly and properly when we are in the workplace, when we are at home, and especially in the midst na mataas ang mga kaso, we just can't be compliant with or complacent with all of this na hindi tayo comply with them health protocols.
Thank you, Dr. Jean. Another question about the variant of concern. Is it warranted to have a negative RT-PCR prior to hospital discharge?
Okay, so pabalik-balik na tong question, no, sa mga pasyente rin. No? So
yes.
we don't the policy for discharge is still the same, no? We follow the time-based, which means na pag halimbawa mild to moderate, once the patient is 14 days na or patient is already improving ng symptoms, wala na yung symptoms niya, then we can discharge these patients, no? And we don't need to repeat the RT-PCR to say that this patient has recovered or should be pabalikin doon sa community.
Okay. There's a question here that needs clarification. What secondary attack rate means? Because okay, I think you mentioned this earlier.
Yeah, yung secondary attack, dalawa yan siya, no? It's either the secondary attack is the number of person that got the infection and chances of being also COVID positive. That's the secondary attack. And since you have a virus at least highly transmissible, that's also expected na mataas ang secondary attack. Mas marami kang mahawaan. You as the index patient and the other person, the next patient that got the infection from you, that's what you call the secondary contact.
Okay. And then the next most frequent question in the chat box for Zoom would be, will a third dose protect us more from the Delta variant? Or would you recommend a booster?
Okay, so when we look at boosters, no, tatlong bagay ang pwede nating pag-isipan muna bago tayo magbibigay ng booster. One is there waning immunity with the current vaccines? Bumababa ba ang protection sa mga bakuna na binibigay natin? So titingnan natin ang population, titingnan natin yung breakthrough infections. Dumami ba ang nagka-infection doon sa nabakunahan kumpara doon sa hindi nabakunahan? Sa tingin ko ngayon, makikita naman natin na ang mga na-admit sa mga hospital, ganun pa rin ang trend, ang hindi nabakunahan kumpara doon sa nabakunahan. Okay. Pangalawa, yung risk of reinfection, no? Isa din yan. Tapos, risk of developing more severe infection. So, for now, I think nakikita natin na those vaccinated are still protected. Okay? Ang unknown lang dito is kung kailangan tayo mag-booster at what point in time. Kasi alam naman natin na ang mga bakuna, meron talagang hangganan yung tinatawag natin na protection. Okay? So, the other most important factor here is also equity, yung supply ng bakuna natin. Now, ang government natin is really targeting for a herd immunity na halos dapat lahat mabakunahan. Now, if you will use a booster, and yung booster na yan, gagamitin mo doon sa mga nabakunahan na. Tapos, you will also not give instead of giving that to those not vaccinated, medyo mas dihado ang mga hindi nababakunahan. No? So, ang point ko dyan is we need to evaluate and furthermore, really evaluate kung talaga bang kailangan natin ng booster at this point in time. Kung kailangan man, titingnan din natin kung sinong bibigyan natin ng booster dose. Okay? Depende na yan sa mga breakthrough infection, yung risk of getting the severe infection like those with comorbidities, those with immunocompromised. And hindi lang ganun kadali mag-recommend ng booster in the scenario na napakalimitado ng bakuna natin ngayon.
Correct. It's all about supply and equity. Yung parang, ang na-imagine kong analogy, sir, ang dami pang hindi kumakain. Nagsi-second serving ka na. Parang ganyan yata yung... Pero syempre,
Yeah.
simplified lang yan. So, ang gusto natin, mabakunahan muna natin yung lahat because yung hindi nababakunahan, yun yung nagiging parang environment ng virus para mag-mutate. Okay. There are other questions I'll try to answer regarding pregnancy and vaccination. There's a recent statement from DOH and the Obstetrics and Gynecology Society. They're advocating for vaccination, okay, regardless of AOG. And then the question about, dami sir, sorry ah. Also about the G6PD, pwede po kayong magpabakuna. There are questions about deferring vaccination when patients have been vaccinated with rabies due to dog bites. What is the current guideline knowing that CDC has allowed the administration? I think Dr. Jean has also mentioned this and showed this in his slide regarding the timing of vaccination. Ngayon, ang pinaka-importante po dun sa co-administration of vaccines would be to know ano po yung risk for the vaccine preventable disease. Ngayon, kung rabies, na mataas din po ang mortality, okay, pabakunahan niyo po ng rabies din. Okay? But have to discuss with the vaccine recipient na pwede pong mag-adverse event kung halos magkatabi po or magkasabay ang pagbigay ng bakuna. And then, i-report lahat po ng adverse event na yun. Okay. There is a question from Manila Times. Do you think kaya po ba tayo nagkaroon ng Lambda is because it naturally mutated or is it also possible na yung akala natin na nag-recover ay may viral load pa rin?
I think we need to know, no, kung saan nanggaling yung Lambda. Is it coming from a returning OFW or from other countries, or is it locally detected variants of interest, no? But alam naman natin yan na there's always a possibility that variants can always emerge, especially in a setting where there is continued transmission.
Okay. Do you have statistics on the number of breakthrough infections among the fully vaccinated individuals, sir?
So far, wala pa akong data on that. No? I think DOH will be collating those data, no? Since that's part of the agreement that with an EUA, you'll also be monitoring those who were vaccinated. At saka nakita natin doon sa data ng FDA, no? Yung after receiving the second dose, no? And we'll wait for the more extensive data, especially for the healthcare workers and currently admitted patients, how many of these patients have breakthrough infections, and titingnan natin yan. There will be data for that.
Yeah. Okay. I'm also trying to respond to some comments or questions regarding vaccination in relation to treatment for PTB, if you're on steroids. So for the TB on those receiving anti-TB treatment, there is no reason why you should not get the vaccine. Hindi po makakaapekto yung pagbakuna dun sa gamot na tinatanggap nyo laban sa TB and vice versa po. For those on steroids, ang kailangan lang po dyan, ang medical certification. Bakit? Dun sa nabanggit ni Dr. Solante earlier regarding the immune system, yung mga tumatanggap po ng mga steroids or kahit anong immunosuppressive medication, gusto natin pinakamababang dose para nga yung visa ng bakuna na pwedeng makuha doon sa bakuna na yon ay makuha niya. So, kailangan ng certification, syempre, or clearance from their doctor. Dami pa, sir?
Anong oras ba tayo?
There was a question regarding... Hindi, last na to. Sige. First dose of AstraZeneca vaccine and second dose last March, but second dose was not given for some reason. How can she avail safely of any brand of COVID vaccine after the first vaccine is given? Most of the questions is like this, sir, yung timing. Kunwari, yung sa Sputnik, hindi pa dumadating yung dose to supply, may mangyayari ba dun sa pagtanggap or dun sa schedule ng pagtanggap nila mga dose 2 nila?
I think alam naman natin yan na pag medyo tumagal yung interval, no? You're still protected but we'll have to wait for the second dose, no? Hindi tayo pwedeng magbigay ng another platform of a vaccine just to compensate for the second dose of either an Astra or Sputnik vaccine.
Okay. And then for the other questions, I think Dr. Jean also answered those in his lecture. Again, best timing for vaccines in HD patients before or after HD session? Parang walang data niyan, sir. Basta sa amin, pwede ka magbakuna for CKD patients.
Yeah, anytime, as long as they are asymptomatic and in fact, isa sila sa mga priority, no? Those with comorbidities.
Yes. And then for anyone suffering from a long haul COVID, yes, they can receive the COVID vaccine at any time as long as they have completed the recovery and isolation criteria. Okay? And then, the other questions are about boosting. Dr. Solante, please comment on the safety and immunity enhancement of a booster dose 5 months after 2 Pfizer injections.
Yes, they have data. Pfizer has data already, no? Yung third month after mataas ang antibody response, no? And that's why I think that's what they advocated in the US. They will be giving a third dose of that, no? But CDC did not grant, or the FDA did not grant them in terms of giving a third dose because the 2-dose regimen is still very highly protective at this point in time, especially with the mRNA vaccines.
Okay. For there's an anonymous attendee asking, suppose po ng DOH FB page kagabi at 8 p.m. to date, there have been 0 deaths caused by the COVID-19 vaccine. But in your slide po, kanina may data ng death after COVID-19. Ano po bang ibig sabihin nun?
Yun sa bakuna siguro yun. Yung sa FDA, no? So that's the FDA, no? After 2 doses of Sinovac, only 1 death out of the 5 million that were vaccinated. 91 nagka-COVID, and I think one of that died. No? So that's still a big benefit, no, compared to the risk of that.
And then, ito sir, about variant testing na lang po. Is genome testing for variants done randomly, and can you explain the process of selection for those who are infected with COVID-19?
Okay, so
Baka
these
kasi nagtataka sila, sir.
Wala namang ano doon, as long as you will send the specimen to the Philippine Genome Center, no? Hindi lang natin alam kung kailan darating ang result niya, no? So it's walang criteria kung sino yung kailangan i-genomic analysis, no? Sometimes there are those that we would like to get kung anong variant siya in terms of younger population na nag-severe, isa yan sa mga tinitingnan, no? Or for those families admitted and in one cluster, titingnan din kung variant of concern. So these are some of the common scenario why some hospitals are sending their specimen for genomic analysis.
Okay. So one of the other frequently asked questions would be about the occurrence of COVID infection in children. Would you like to comment on that, sir? And then after that, you can give your final message.
Okay, so based on my experience here in San Lazaro Hospital, no, compared to last year, mas marami-rami ngayong mga bata ang na-admit, no? In fact, we have 3 months old, 6 months old with COVID. And then we also have 1-year-old, no? Lahat ito ay nanggagaling sa mga parents nila or mga caretaker. Kaya napaka-importante, no? Dahil sa mataas ng hawaan, to the point na mataas na rin ang hawaan sa mga bata coming from the adult. Kasi ang adults naman ang nagdadala pa rin ng mga infection na yan doon sa mga bata. So that's what we always emphasize, no? You have to protect hindi lang bata, hindi lang matanda ngayon. When you go home and you have been potentially exposed, especially if you are going out every day, then you have to really be careful in handling yung mga bata at saka yung mga matatanda, because there's a possibility exposure can lead to infection, and alam naman natin ang mga bata at saka matanda, sila din yung higher risk na mataas ang chance na mag-develop ng severe, no? So siguro net banggitin na rin natin, no? Meron ng statement ang PIDSP at TPS na as of this point hindi pa natin, due to the limited vaccine supply, no? Ang pina-prioritize pa rin natin ang mga matanda compared sa mga bata in terms of receiving the vaccine.
Final message.
Okay, so nakita natin, no, napaka-importante ng bakuna, no? Especially at this point in time na meron tayong surge of cases, mas dito kailangan natin mas maraming mabakunahan, no? Because long term and short term, mataas ang benepisyo ng bakuna, hindi lang doon na hindi ka ma-hospital, but also the risk of transmitting the infection. Maganda rin ang epekto ng bakuna.
Okay. With that final message, advocating for vaccination, we thank everyone for participating and apologize for not being able to answer all your questions, but we were told that your questions will be forwarded to PCP Secretariat, so we will have the opportunity to answer them. Thank you to everyone and to all the organizers. Maraming salamat po.
Yeah. Thank you, Net. Thank you, Danny, and the other